Firstly, I'd like to say welcome and thank you for the opportunity to speak. And also just to correct the fact that I'm not a professor, I'm still a doctor, so just to get that straight. I think this is quite exciting, and I'm here to speak to you about something that's been my interest for the last, for many years as I can remember, and it's all about injury. It's a seemingly unimportant foe, and it is really making a massive impact and the leading threat in the South African physically active population. It's not caused by germs or a virus, but rather a tradition to excel, exceed, and succeed. And injury really is really affecting vast populations. It's definitely the leading cause of readiness for our military. It's causing problems that we can't really go and send a full brigade, for example, to the Congo. And at the same time, it's definitely a threat to the sporting fraternity, and we all know the economics behind that. So definitely something to ponder about, and it is rather a bit of a serious topic. I think if one has to think of epidemic as being widespread, very prevalent, and experienced by many people at the same time, then our sporting fraternity and our military in South Africa is experiencing an epidemic of injuries. The World Health Organization has indicated that injury is the leading cause of death in all people younger than the age of 60, and a leading cause of burden of disease in the country and in the world. It accounts for 9% of all deaths in the world and 12% in the burden of disease. But what really one needs to bear in mind is that injuries are not, the people that die from injuries are far and few between. It's more the people that are injured that often need to be hospitalized and then rehabilitated that create the problem in these institutions, and they have these injuries have far-reaching psychological, economical, and physical impacts. But it's not all doom and gloom. There are definitely agencies, especially in the last 30 years or so, where they've tried to look at who is at risk, where injuries come from, what causes injuries. But the problem in South Africa more is the inaccuracy, if you want, or the lack of the ability to keep record. And the statistics are often not reliable enough to make deductions on the health status of these injuries. Scientific studies definitely tell us now where injuries come from and who is most at risk. Working, yes. And that risk is where my interest and my passion lies. I've always been fascinated to find out, what causes a problem, and I've always tell my students, and I see some of them in the audience today, and I'm sure they've heard this before, when you can understand a concept like injury, for example, or a variable or construct like the site of injury, or the number of injuries, or the frequency of injuries, then you can start manipulating in these injuries or these variables, and hopefully understanding it will enable you then to prevent these injuries. An injury can be classified as being either acute or chronic. Now, your acute injuries, we've all experienced them when you're walking across and you bump your leg across against the corner of the table. Some profanities might escape your mouth, and then it's not really often a preventable injury. It just happens. But there is another group of injuries which are preventable, and those are your chronic overuse injuries, which are injuries that develop and occur over and over again. They are caused by forces of relatively low magnitude compared to the acute injuries, and are applied in a very sort of over a long period of time. And these definitely can be very problematic. Some of these injuries you might have experienced, anything that ends with a TIS, tendinitis, bursitis, all of those are these chronic overuse injuries. And part and parcel of these injuries includes a stress fracture. Now, a stress fracture, I experienced quite a few of them, or observed quite a few of them as practicing as a biokineticist. And a stress fracture really has grabbed my attention and my research for the last 15 years. A stress fracture really is a partial or incomplete fracture which occurs on a bone, which is caused by the inability of this bone to withstand the stress or the load that it is applied in a rhythmic subthreshold manner. And they were originally called marching fractures or fatigue fractures, and the reason they were called marching fractures because they were originally identified in the late 1800s in soldiers. And then they're also referred to as fatigue fractures because it really represents what happens to the bone. The load results in fatigue, and it just cannot withstand the load, and then it eventually breaks. So my interest in stress fracture really started in my other life when I practiced as a biokineticist in the South African military for 15 years. And what I would pick up when practicing is that I would see these young, eager soldiers joining the military, going into basic training, giving it their all, and then suddenly developing a stress fracture and being benched for 6 to 9 months. And then not with consequences, they wouldn't have the ability to then complete their training. And so when it was time to renew their contracts, the contracts wouldn't be renewed, and out the military they went. So this was problematic not only for the poor wannabe soldier, but also the financial burden. And yes, your and my hard-earned rand was paying for this period of rest that these recruits were undergoing. Of special interest at that time was also a very high incidence of pelvic stress fractures. So these stress fractures in the pelvic and pubic bone were developing in our female recruits. And so the question came up, well, why is this occurring? So we started investigating, is there something that is inherent to the person or to what they are doing that puts them at risk? So we started investigating these risk factors, and these risk factors can be identified or grouped into 2 boxes. Us left-brained like boxes. We put things into categories. And so the one box is your intrinsic risk factors, and those risk factors are all the characteristics that are applicable to your person. So if you've got knock knees or bow legs or so on, those are all intrinsic characteristics. And so the journey started looking at these, started looking at these intrinsic risk factors. And one of the things that is predominantly sort of documented in the research is that young people tend to be immune to stress fractures, and your older individual is more predisposed, as is a female more predisposed to developing stress fractures than their males. However, one interesting fact arose from the research is that if you had to take a lady who is older than her male counterpart, but they had equal physical fitness, then the risk seemed to die away and was lost. So physical fitness seemed to be the core or the key in this whole investigation. But of course, there were other intrinsic risk factors that would possibly predispose somebody for a stress fracture, such as if your left leg is 2.5 or half centimeter shorter than your right leg, you're more predisposed to developing a stress fracture. And also, if your bone density is lower than what it should be, especially in females, then you're also predisposed to developing stress fracture. There also seems to be a bimodal trend with regards to fatness. So if somebody is very thin or very obese, they've got a greater risk for developing stress fractures. Also, hand in hand, if you've got poor aerobic fitness, low muscle strength or poor muscle strength and low muscular endurance, that also seems to predispose you to these stress fractures. So all of these intrinsic risk factors, and I have competition outside, but all of these, maybe he's just got a stress fracture. But all of these risk factors really do, all these intrinsic risk factors play a role in developing stress fractures. The other sort of box that we looked at was the extrinsic risk factors. So in other words, what is outside of the person that maybe we are doing and that is predisposing the individual to stress fractures. And so the journey of research took me into looking at the surface on which the troops were running on, the equipment they were using, the shoes they were using. And what it really boiled down to is that an old shoe is not great. You should rather wear a newer shoe with better shock absorption, trade the army boot in for a normal sneaker or a tacky. walk on rather even surfaces than rocky, hard terrain, that seems to diminish or decrease the risk of developing these stress fractures. But what makes the clarity regarding understanding the risks for stress fractures very difficult to make is that these intrinsic and extrinsic risk factors all sort of merge together, and they are sort of influencing the other. So you can't just say if somebody has a shorter leg than the other that they are going to get a stress fracture. Maybe if they have a shorter leg and they're slightly not very fit and they're wearing a heavy backpack, they have a greater risk. So the investigation of this and understanding this becomes very complex. One thing, though, that did come to light with this high incidence of pelvic stress fractures, we were able to identify two modifiable risks. And the first one is that the first problem that arose is we follow a mixed training approach in the military. In other words, we allow men and women to train together, which, because we do not want to be marginalized and in any way put aside, but it's come to at a price. What happens is when you line your platoon up on the parade ground or for drilling purposes, you generally tend to line them up from tall to short to make them look pretty, which is great because they do look pretty. The only problem is that when they are standing there and the shorties are in the front leading the platoon, it's all fine for the shorties because they are setting the pace and the stride length. But once there's an about turn and the tallies are in front, what really happens to us poor shorties at the back is that you have to start extending your stride to keep up with the tallies in front. And such a simple problem resulted in an excessive amount of forces being placed on the pelvis. And because it was done day in, day out for a period of 3 months, these ladies developed stress fractures because on average, the females were about 10 centimeters shorter than the male counterparts. The second, and that was easily fixed. We sort of put them up, line them up, put the tallies in the middle, and taper it out with all the shorties on either end. So that was quite easily fixed. The second one wasn't easily fixed as quickly because the military issues equipment based on a one-size-fits-all approach. If it sort of fits, then that's great, off you go. And that's what they were doing with the backpacks, which isn't a problem if you're of average size, around about 1.75 tall. But if you, lucky me, 158, you have a problem when you put the backpack on, because what happens is that the backpack sort of goes down lower onto your pelvis, and as you walk, it hammers against your pelvis. And that repeated subthreshold forces that were applied on the pelvis resulted in these stress fractures, this high incidence of pelvic stress fractures. And unfortunately, that problem wasn't easily solved because of the financial outlay of purchasing, the correct backpack for the size of the recruit. But definitely, one of the things that has emerged is that strategies to reduce physical training injuries have the potential of reducing in these kind of chronic injuries by 25 to 50%. But herein lies the challenge. The challenge is that it's not the medical support staff like myself who needs to be able to apply this knowledge. It is the soldier or the athlete who should be empowered with this injury prevention knowledge, and as well as more importantly, the person in the leadership position, so be it the platoon commander or be it the coach or the manager. They are the ones in the position of power to implement these changes and hopefully then reduce the training injuries that we see in the recruits. So that's really where my interest lies, is the injuries of recruits and also the injuries of athletes. And that's my story. Thank you.
Paola.